Butler Health System is fine-tuning the way they treat patients with chronic illness.
So I'm a board-certified music therapist. It's a profession that's been around since, especially World War II, with post-traumatic return of soldiers, is when it really became kind of an accredited profession in the United States. But it's a world-recognized certification, and it's practiced all over the place. And in this area, we're lucky. I mean, there's a lot of people practicing in this area, and a lot of health institutions that see it as valuable. So I got my undergraduate degree at Slippery Rock University, passed my board exams, did my internship in hospice care, working at bedside with patients or in bereavement support groups. And to give a textbook definition of what is music therapy, it's the intentional use of music by a licensed, credited professional to support therapeutic goals with music. Now, what that actually means is that I, as a therapist, am going to meet with a client or a group setting like what we're doing tonight, and we're assessing what are their needs, right? In this case, for music and wellness, it's chronic illness. So we're talking about pain management. We're talking about stress management. We're talking about rest and relaxation. We're talking about muscle control and releasing tension. And so we're going to use music to meet those goals. That might be through guided imagery. That might be through progressive muscle relaxation, which is what we're going to do tonight. It's through rhythmic breathing. It's sometimes through playing an instrument and getting that expression out that way, or grounding that way. With children with autism, we might be working on something more like making eye contact or following multiple step commands or social cues. And so it just depends on who you're working with and what their goals are, and how can music reach those goals. In something like this, through chronic pain, there's copious amounts of research that show that, deep rhythmic breathing can lower heart rate, can lower blood pressure, can increase lung capacity, all of which are things relevant to someone suffering a chronic illness. But we talk sometimes in this group, if I get hit by a car, right, there are physical consequences to that, right? Biological, physical consequences in my body, and that causes me physical pain. But I also have the emotional pain of, what does this mean for me, right? What is this going to mean for me financially and emotionally? And am I going to be able to function the way I used to? And how is this going to impact my family? And that all causes pain also. So by having a group like this in a setting where we're saying, here are skills that I can teach you to manage your pain, whatever capacity of pain that is, I now give you, someone who's suffering from chronic illness, some autonomy again, some self-control again, something you can do to regulate what's going on in your world when so much of it is out of control, right? Cancer is out of my control. I can't change that, but I can learn to manage it. And if I have some skills to support and navigate that, then it's not going to be as painful.
From the roots form the branches, steady and slow. Rain, sun, wind, and storm all help it grow. The magnitude and majesty of each living tree, contained in the potential of one single seed.
This has been a Butler Eagle Report.